Welcome to Freedom from Fire. As always, we have a glimpse into the Philadelphia Fire Department and how we operate. Today, we're focusing on the emergency medical services side of the department and highlighting our alternative response units. We'll hear from the people who provide this specialized care next on Freedom from Fire. Hello and welcome back to Freedom from Fire. I'm your host, firefighter Kamilah Bayete-Taylor. I'm currently stationed in our department's Fire Prevention and Code Division, where community risk reduction efforts are a primary goal. Here at Freedom from Fire, we aim to improve your quality of living by giving you fire and life safety information. We also introduce you to our local safety partners and department leaders. As you know, we're both a fire and EMS department, and we often respond to 1,000 emergency calls per day, most of those being emergency medical calls. Today, we're talking with members of the PFD's alternative response units, which were established to provide specialized care to unique populations. Joining us are paramedic Michelle Roach and EMT Barry Stith. Michelle, Barry, thank you so much for joining us today.
Thank you for having us.
Thanks for having us.
All right, so first, let's start off. Tell us a little bit about yourselves and how long you've been with the department.
I became an emergency medical technician with the fire department 9 years ago, and been through a variety of different units. I'm currently assigned to AR2, AR2A, which is our opioid response unit in Kensington.
Okay, all right, and you, Michelle?
Next month, St. Patty's Day will be 21 years for me, and I've been in several units throughout the city, and last year I was asked to come to AR3.
All right, so how many are, you mentioned already 2 units, so tell us how many alternative response units there are in the PFD.
So you have AR1, which is our first alternative response unit, which is stationed in the University City area. And you have AR2 as well. Again, like I said, that's the opioid response unit. Then you have AR3, which Michelle is assigned to, that handles behavioral health. Okay,
and so let's talk about AR2. What kinds of calls does AR2 get? I mean, you mentioned opioid response, but tell us like a typical day.
So a typical day in AR2 would be, responding to calls for service where it involves overdoses or community outreach where individuals are looking to recover from substance use disorder. So we work along with case managers through the Department of Behavioral Health and Intellectual Services, where our case managers aim to get the person directly from the overdose to a treatment facility instead of being left out on the street or trying to get into a treatment independently.
Okay, that's a great service that we provide. So tell us a little bit about your unit.
So AR3 is Alternative Response Unit 3 for behavioral health. I work alongside with a behavioral health specialist, and we have a medic unit where we have another behavioral health specialist with an EMT and an EMTA, and we do outreach and we do mental, emotional, and crisis runs.
Okay, so taking it, you're responding to a lot of medical crisis type situations. Did you receive certain type of crisis training to be able to respond to those?
So in the unit, we're all CIT trained, crisis intervention training, where we learn to de-escalate the situation, and instead of calling in the police if we don't have to, we de-escalate the situation and we're able to get the person into crisis if need be.
Oh, that's great. That's great. Now, in which situations might you be deployed over an ambulance? Like, is there certain situations where they say they could deploy an ambulance, but we can now deploy an AR unit?
For AR2, our community outreach typically has us deployed before an ambulance or a medic unit arrives on location. Typically, most of our calls, unfortunately, start with overdoses. So a lot of the times we get there, if a person does not want to go to the hospital and they refuse properly, then they'll be handed off to AR2, where we can start to process the treatment.
Alongside with AR2, we do the same thing with going on the run and recalling the medic unit and getting them back into the field if need be. We may use them to transport to the hospital.
Okay. And so in hearing what you guys are doing and how you're interacting and responding to calls, and I'm taking that will free up medic units to be able to respond to other emergencies.
Yes.
Okay, that's excellent. That's excellent. Now, what is the process like when someone calls 911? How do you all get involved?
I can say for AR2, we are self-dispatched, so to speak. If a call for service comes out, we listen to the radio, identify calls that would be particular for our unit, and we will respond on those to see. Sometimes we arrive on location and, the person has to go to the hospital, but again, if a person is there and they're willing to seek treatment, then we're right there with our case manager to, get them from where they are and hopefully start their journey into treatment.
In AR3?
We are self-dispatched as well, or we're requested by other medic units where we'll go on location with them and evaluate the situation, and then see if they're going to go to crisis or they're going to go to the hospital to be medically cleared.
Okay. Okay. Now, do you work, you mentioned that you work with behavioral health. Do you work with other partner organizations?
Yes.
There are different organizations that do referrals as well for us, but our biggest support comes from behavioral health, because there's a lot of different resources that they have available, that they make available to us to get people into the places they need to go.
Okay.
Yeah, we work alongside with the COC and the Department of Behavioral Health and Intellectual Disabilities, and the NAMI as well.
Okay. And in terms of the role behavioral health plays in this process, are they involved in, like, I'm assuming some of the responses you go to, there needs to be some type of de-escalation, in some cases. So does behavioral health play a role in that? Are the police called, or how does that work?
Sometimes when the police call, the situation is pretty much de-escalated, and we're going to be transporting them as a 302 patient.
Okay.
As far as AR2 is concerned, most of our calls, because a lot of our responses are on the highway, when we get there, sometimes we do get police. Sometimes, we are able to mitigate the situation before police arrive. We really, don't have the need to work with them, but as far as like the behavioral health piece, our case managers are trained, and they're trained very well, so they can recognize if any additional service may be needed outside of the scope that both of us can handle.
Okay. All right. Now, how many calls do you guys get per week or per month?
Honestly, I want to say for us, our community outreach side, we can go 30 to 40 people a week, just, getting the information out, and maybe 2 to 3 people placed into treatment per day.
Wow.
We do, as well, we do the outreach and we get dispatched or requested, so it depends on a day-to-day basis with us.
Now, you guys, you've spent a lot of time in the field, but prior to going into alternative response in medic units, what drew you to the alternative response side of EMS?
For me, I saw that there was a unique opportunity to get out there and do something outside of, what we would do on a day-to-day basis. We know that the Kensington section has had some issues with the opioid epidemic, and it just seemed that it would be beneficial to get out there and try to make a difference in that community as well, just, for a change, and to see what better we can make out there.
Thanks.
And with me, it started back when I went to college. I have a degree in sociology, and on the department, I'm in peer counseling, and I enjoy just helping people.
Excellent, excellent. All right, well, we're going to take a short break, but when we return, we'll continue our conversation with the PFD members of the Alternative Response Unit.
As birthplace to the first volunteer fire companies, Philadelphia is home to one of the nation's premier fire museums. Fireman's Hall Museum displays the city's fire history in addition to promoting fire safety. You can visit Fireman's Hall Museum in Old City at 147 North 2nd Street. Visit firemanshallmuseum.org to learn more, or watch the museum's show, Curator's Corner, on LaSalle TV.
I drive 65,000 miles each year in my bus. If people knew what I know, lives could be saved. You don't want to be in the blind spot of a 40,000-pound bus when I have less than a second to react. I do what I can by changing lanes and taking turns slowly. It really helps when people look out for me too. Give me room to operate safely. It's our roads, it's our safety.
Did you know that listening to music, enjoying art, or simply holding hands can boost your cognition? Trying new foods, making friends, and being curious helps too. Just like me, you want to maintain your brain health for as long as possible. I'd like to share with you insights that can make a difference. I'm Kevin Jameson, President of the Dementia Society of America. I'm excited to offer you our free guide. Inside, you'll find 10 building blocks to better brain health, along with facts about dementia, care planning, and how experts make a diagnosis. You'll learn what dementia is and isn't. The Dementia Society of America is a nonprofit organization, and we are ready to answer your questions. Get your free copy of the guide by visiting 1-800-DEMENTIA.org or by calling 1-800-DEMENTIA. You want to live life to the fullest? I do too, and I'm confident that our free guide can help.
Welcome back to Freedom from Fire. I'm your host, firefighter Kamilah Bayete-Taylor. With me today are two members of our alternative response units, paramedic Michelle Roach and EMT Barry Stith. All right, so before the break, we were talking a little bit about the volume and type of calls you get. Now I want to shift over to something very good, some good news, recent news. It was recently announced that the Congressional Fire Services Institute chose the PFD to receive the 2024 Excellence in Fire Service-Based EMS Award. And it was because of the AR units, correct? All right, so I know none of us go into this career for awards, but let's talk about what this award means and why it's important for the PFD in receiving this distinction.
I honestly think that, you know, to receive such a prestigious award, it's outstanding, if you ask me. The department has, in my opinion, reached a milestone. I think we could actually be a model for other agencies that are looking to develop such programs and maybe shape the way that their responses are. Here in Philadelphia, I think just the way that we model ourselves, the pride that we have, and the way that our units, you know, kind of gel together, I think is something that if other people wanted to, you know, kind of write a playbook, then this would be the reason to do so.
That's excellent. Sounds like something you're very proud of.
Absolutely.
Yeah, yeah. So are you aware of, are there any other units like the AR units we have here in other parts of the country?
Not so much knowing if they exist. You know, I try to do a lot of research because, of course, we could always do better, and we always strive to do better. But to my knowledge, I haven't seen a response model such as the alternative response model here in Philadelphia.
Wow, so Philadelphia Fire Department setting the bar.
Absolutely, setting it pretty high too.
Excellent, excellent. So how do the AR units, how would you say the AR units contribute to the well-being of the city of Philadelphia?
It actually frees up resources so that, you know, our medical providers could actually address the medical situations, and we can handle the specialized needs of the citizens of Philadelphia, even if it's on an outreach level, you know, making referrals for the different agencies, homeless outreach, and, you know, more quality of life issues.
And besides, like, helping units out in the street and freeing them up and getting back to other 911 calls, we're able to divert the hospital to go to the crisis unit or into rehab.
Excellent, excellent. Yeah, I mean, Philadelphia Fire Department is one of the busiest EMS systems in the country, averaging, close to 1,000 calls a day. So that definitely, in terms of freeing up resources, we're responding to a lot of calls. So that's an excellent program that the AR units created. So are there any interesting experiences you've had since joining Alternative Response that you can share with us?
I think it's just the nature of the day-to-day job. I mean, there's times where we can end up on the railroad tracks, or we can end up in places where people wouldn't imagine. It's not one particular interesting situation because they get more interesting by the day.
Interesting. What would you say, Michelle?
I just really like that when you help that person and they are so appreciative at the end, and they just are very humble and thank you. I just love it.
Interesting, interesting. Yeah, so when you how you're explaining you respond when you respond to the experiences you had when you respond to the AR calls. How would you say they're different than the calls you responded to when you were working in a medic unit?
Sometimes I can tell you that, being a provider on the street, we never get to see the end result. As a provider in the alternative response unit, you tend to run into individuals who end up doing very well for themselves, and they're more appreciative. So you get to see the back end more than you would if you were a field provider. So I think that's a rewarding thing for myself.
Excellent, excellent. And what would you say?
With going out and doing outreach after they've had that crisis, and they are so appreciative and just so thankful, and you could see it. You could see that they're become better, so to speak.
That's great. That's great. When I was in college, program they started a program for a recovery program. So it was basically like a recovery dorm that they had for recovery students, and it was one of the premier recovery models in the United States about getting people who are struggling with addiction into recovery, but then also giving the opportunity to advance, and giving them to help with tuition, room and board, and all that. So I can attest to just being able to see when you're creative with alternatives, and able to see kind of how they work, and it's great. So now, what is the most challenging, since you've gone into alternative response? What can you say is one of the most challenging things for you?
There are some people that have a lot of different barriers to their treatment plans, and sometimes care isn't always an immediate option because of, where the person may be from. So there are a lot of people that end up here in the Philadelphia area, which, not being from this particular area, it's kind of hard to place a person. But, these are just barriers that we have to, overcome. We have a lot of people that, whether they wait a couple hours, we're still going to make sure we get the job done. We actually have a mobile office that's associated, which is AR2A, and even though we engage with these individuals, we bring them back to our mobile office, and there's what we call creature comforts there. We have food, soup, things like that, where we can distract them from everything that's going on, kind of get their mind off of it, and pretty much help them through the process so that they're not getting antsy, because again, it's got to be overwhelming trying to make a change, after they've been, addicted to certain, whether it's drugs or alcohol. So.
Wow. And what would you say?
I'd say that maybe de-escalating the situation if they just don't want to go, but once you're able to de-escalate the situation and they start to listen and they understand and they say yes, they want the help, that's the most rewarding to me.
Wow. And so you talked about AR2A, and I believe there's an AR3A as well?
Yes, it's our medic unit.
Okay. And is it the same thing just in terms of, the larger vehicle where someone can come in and spend some time there, while they're...
So we use our medic unit to transport,
Okay.
if need be, for specialty cases, it's senior citizens,
Okay.
or someone that we need for them to sit on the stretcher that's, you know, need a little extra help.
Okay, okay. Now, since you've been with the alternative response units, what can you say is the most rewarding, been the most rewarding part for you?
Seeing positive change, you know, it's always a good day when you don't see the same person coming back, you know, that may have relapsed and things like that. Like I said earlier, there are some individuals who, you know, they come back and thank you. So, yeah, that I guess will be the most rewarding because it means that we're making some type of a difference. So.
Absolutely.
And
Michelle,
it's just the positive outcome of the run, that they want to go and they want to get help.
Absolutely. And where would you like to see this unit? It's still fairly new. You know, you guys have been doing so much work since it's begun. Where would you like to see it go next 5 years, 10 years?
Me personally, I think if we were able to expand to different areas, you know, as we know, some issues don't just go away, they just relocate. So it would be good to, you know, have the resources to be able to follow these problems to kind of make it a citywide situation. You know, I think that would be it for me at this point, and to continue growing with positive staff and interactions.
Absolutely.
Yeah, it would be great, like if we were to have an expansion, because we have a small catchment area, and we do go outside the catchment area, but we would need another unit, which would be great.
Wow. And how many people are in your unit now?
Oh,
Within each AR unit?
So AR2 has rapidly expanded over the last year, so I would say about 10 people, but I could be wrong with that. But it's positive growth either way. You know, I mean, I'm enjoying the people that we have, and I think that, you know, we all work well together. So, yeah.
And how many people in a
So
AR
it's
unit?
myself and a behavioral specialist, and then we have the medic unit with an EMT and the EMTA with another behavioral specialist, and that goes on the opposite platoon as well.
Okay, okay. Well, I know definitely, I mean, every time I see someone from an AR unit, you know, when I'm around the building, you all guys always look happy. You always look like just happy to be working, happy to be here, happy to be going out to wherever you're going. So that, I mean, you guys are doing a very special type of service. And it's great to have people doing it who really want to do it, you know, so.
We're all passionate about it.
It's very evident. It's very evident. It's very evident. So what in terms of your career in the Philadelphia Fire Department, when you started out, did you see yourself going into something like this, the AR units, or did you see yourself just continuing on the?
Originally, when I got on the department, of course, we all have that, you know, retirement goal, so to speak. But the AR units weren't even a thing when I got on. So, you know, the more I started hearing about it and learning about what the purpose of the unit was, I mean, I had to be there because I wanted to be a part of something that was, you know, going to make a statement for the department and essentially be a part of history for the department.
Part of history.
Yeah.
And you, Michelle?
I just enjoy it. I mean, you know, it's a passion of mine's helping people, and behavioral health and substance abuse has hit my family, so I just want to help do my part.
Absolutely. I mean, that definitely, we hear stories all the time of being personally impacted by those things, and how that's how a lot of people got into the fire department, you know. It's that someone showing up at their home for a medical emergency or a fire, and them being exposed to that. So definitely appreciate that. Anything else that we haven't talked about that you like to add that you think might be important for us to know?
So the one thing, you know, I know we're talking about the different alternative response units, but I wanted to kind of touch on our very first AR unit, which is AR1. You know, that unit seems to be one of the better. We like to call them the night crawlers, so to speak, because they are a night shift unit. But it seems to have made a difference out there. They deal with a lot of intoxicated college students and things like that in the University City area, trying to keep our resources available for the residents of West Philadelphia as well. So, you know, we definitely couldn't go without, you know, highlighting a little bit of what they did because they are a part of our team.
Love that. Love that. Yes, Michelle.
You know, there's really nothing much I have to add. I mean, we've said it all, you know.
All right, all right. Well, thank you guys so much. Barry, Michelle, yes, thank you. Thank you. Hopefully we can have you guys back.
Oh, absolutely.
All right.
Anytime.
All right. All right, to learn more about the PFD, including fire and life safety information, job opportunities, and how to request free smoke alarms, visit phila.gov/fire. And if you would like to keep up with our show, Freedom from Fire, look for us on Verizon Channel 36, Comcast Channel 56, and LaSalle TV's YouTube page. Also, check out Fireman's Hall Museum, located at 147 North 2nd Street, and meet with our museum curator, firefighter Brian Anderson. I would like to thank our guests once again for joining us today. In addition, I would like to thank you for tuning in and watching. So until next time, remember, fire is everyone's fight. Stay safe and remain free from fire.